Good morning, Hillary Clinton.
Good morning, Angela Merkel. How are you
I
today?
am fine. How are you?
I'm good. Thank you for
Good, good.
asking.
Well, I am here to ask you about Obamacare. I
Okay.
hear there's a lot of controversy regarding it.
Yes, sir.
So let's get down to business and talk about it so that I may understand it.
Okay, what would you like to know about it?
Well, what is it? What is it about?
Okay, well, it's a series of regulations that are going to help improve the United States healthcare because we know that um, our healthcare is one of the most expensive healthcares in the world, and we wanted to do something about that, and so that's where Obamacare or the Affordable Care Act came into play.
I see. So how is it going to improve your country's health care?
Well, it's going to ensure a lot of Americans who aren't already insured, and it's going to be cheaper. And then insurance companies won't be able to turn people down because of pre-existing conditions, and it's going to allow younger people to stay on their parents' insurance plans longer, so they can stay on until they're 26.
Oh, I see. 26. Very
Yeah,
good.
yeah. Yeah. Did you have any more questions?
I do. Um, how is it cheaper and better than the system you already have?
Well, um, so the way it's designed is it's supposed to decrease the size of the donut hole, which is just the difference between the percentage that the customers pay and the insurance companies pay. And so over time, it's supposed to get smaller and smaller and smaller. So the percentage that the customers pay or the patients pay is going to get smaller and smaller. And that's supposed to keep decreasing until about 2020, when the percent that the patients pay is only supposed to be 25%. And then free screening, we're going to offer free screenings. So for things like you can get free screenings for breast cancer or colon cancer or things like that. Um, and then a lot of the preventative care will be free as well. Smokers, they can get like counseling and things like that for free to help quit smoking. Um, and that's going to help us find problems before they get too bad, so it'll be cheaper to fix them, in the beginning rather than when they get worse and more problems, arise. And that's where the expenses really, really go up. And then, like I said before, insurance companies won't be able to turn people away, so more people will be insured, which will also bring down the cost of health care. And then all of the health care plans that insurance companies offer have to have essential health benefits. And so that's like ambulatory services, emergency services, maternity and newborn services, mental health and substance abuse services, laboratory services, wellness services, oral and vision care, vaccinations, immunization shots, and a lot more.
I see. That does cover a lot. And it doesn't matter what your income is?
No, no, no. It's supposed to be affordable. So they'll have the cheaper plans, if you don't make so much, and then the more expensive plans, of course, if you make more.
What about abortions?
Um, so the way Obamacare is designed is we're going to let the states choose whether or not to offer abortion services.
Why let the states choose whether to allow them or restrict them, but force them to offer the essential health benefits?
The government, the federal government, can't spend federal dollars on abortions. So that's why we're going to let the states choose whether or not to offer it, because we can't fund it, but we can offer some tax credits to those insurance companies and states who do offer abortion. So that's
Very understandable. What about the people who already have Medicare? What about them and those who have uh, funded insurance?
well, it's actually going to get better. The Affordable Care Act is going to help Medicare get better. So most of the plans are now going to have free health care some of their things are going to be free. So like wellness exams and screenings and smoker care and things like that, like I talked about earlier, those are going to be free to Medicare patients. And that prescription cost is going to go lower. It's going to be less expensive for them to get their prescriptions. Um, and so yeah, but not all of the plans are going to be improved. Some are going to get better, and some are going to get um, may have a few benefits cut just because of funding we have to cut from Medicare in order to pay for the Affordable Care
Oh, that sounds very good. How does this act affect businesses?
So if you're a small business, which means you have 25 or less equivalent employees, then the Affordable Care Act is going to give you tax credits if you offer insurance to your employees, health insurance to your employees. But if you have more than 50 full-time employees, then you're being considered kind of a big business. And then we're requiring um, those kinds of businesses to offer health care to their employees. And if they don't, we are going to impose penalties on them and fines for not doing that. And the fine is called the Employer Shared Responsibility Provision, and it's about $2,000 a year per full-time employee.
I see. Well, what about those who do not work and are not on Medicaid? How does that affect them?
Well, the Affordable Care Act is gonna offer. You don't have to get Medicare. That's the Affordable Care Act's not trying to get everybody on Medicare. It's just trying to make it so people can get health insurance. So you can still get a health insurance plan even if you're not, employed. Not everybody takes health care through their businesses or through their employers where they work. So they would have a separate individual health care plan, which people who don't work can still get.
What about if they don't want it?
If it's mandatory for everyone to have health insurance, and so they at the end of the year when they do their taxes, they're going to be fined.
I see. I see. Um, that sounds very nice, but how are you going to pay for this bill? I understand currently the cost is projected to be extremely high.
Well, so most of the bill is going to be paid for through federal and Medicare cuts. So it just cuts to the federal government spending and then cuts to Medicare funding. And then we're also going to have some tax increases, and like the penalties and fines I talked about earlier, those are going to help pay for it. So 716 billion is going to come from Medicare cuts, and then another 741 billion will come from the federal spending cuts. And then as for taxes, there's going to be a tax penalty for those who don't have insurance, and then um, there's going to be an excise tax for it's called Cadillac insurance. It's kind of just like really expensive insurance plans. And then those cuts are going to be about $111 billion. Then another 55 billion is going to come from the penalties that individuals pay for not having health insurance, and then another 106 billion from employers who have to pay penalties for not offering health insurance. 318 billion is going to come from hospital insurance tax, and then an 87 billion from these. And so it's going to plus since it's insuring more people, I talked about how that was going to lower the cost because more people were going to be insured, and that's going to contribute about $216 billion to the cost of the bill.
I see. So taxes will raise in many areas.
Yeah. Oh, there's going to be a tax on tanning. About a 10% tax for indoor tanning. That's also going to help contribute a little bit to pay for the bill.
Right? You mentioned that 716 billion would come from Medicare cuts.
Mm-hmm.
What exactly will be cut from Medicare because of this?
Um, Breaking it down, about 415 billion is going to come. We're going to take from payment rates. And then 156 billion is going to come from Medicare Advantage plans. It's a special plan that Medicare offers. It's kind of a larger one, and we're going to cut that. And then So that would cut some of the free offers that are given to other Medicare users, whoever has Medicare. But if they have Medicare Advantage, it's gonna some of the features that it has will not be free. And then 56 billion is gonna come from cuts to disproportionate share payments, and then 114 billion just in other cuts to the program.
I see. So, with these cuts and costs, will Affordable Care Act have an impact on your national deficit?
Yeah, it's expected right now and projected to reduce the deficit, which is really good for us, of course. Some predict that it's only going to reduce it about 41 billion, but others say that there's only going to be about a $7 billion reduction in the first 5 years. But the CBO says that the deficit should reduce about 5% between 2023 and 2033. So it's going to help.
How are the American people doing with this?
How do they feel? Well, a large portion of America doesn't like it, um, but they have their reasons, of course. So, for example, screenings, like I talked about earlier, like the colon cancer and the breast cancer screenings, like that are free, but diagnosis screening is not, because it's no longer screening; it becomes a test. So, if you went to the doctor because you maybe felt a lump or something, and they wanted to get tested for that, that's a diagnostic test, not a screening, so you would be paid for that breast cancer exam, rather than if you would have just gotten the exam and then found the lump. So people don't like that. They think that that's sneaky. Um, and then, which will discourage people from claiming symptoms that they have, because they'll be afraid, which is going to make it worse, because then the problem could get worse, and then it'd be more expensive.
Yeah.
We're getting into the thing that we were trying to prevent. And then others feel that the act is unconstitutional because it does require that all Americans purchase health care, and they feel that the government shouldn't be able to do that.
I see. I see. So, Miss Clinton, I was wondering if Obamacare does not work out, what are some of the alternatives?
So right now the Republicans have put together a little plan, and the way their plan is outlined, so $6 million is going to come from the states, and then 13 million is going to come from the federal government. So 35 million of that is going to be put toward healthy outcome initiatives, which is just things that make emergency care less expensive and easier to do, and then another 10 million is going to come from the states, and then the government will cover the rest. And 10 million of that is going to go to 20 of federally qualified health clinics that already exist in the United States. The remaining 18 million of that is going to be broken up into three parts. 8 million is going to expand a telemedicine program at the Medical University of South Carolina. 7 million is going to go to optional state supplement programs, which helps aged, blind, and disabled people pay for community residential care. And then the last 3 million is going to go to programs that help repay student loans for doctors who agree to work in undeserved areas in the state.
I see. Well, I appreciate your time. That answers my questions. So thank you very much.
Yeah, no problem. It was good seeing you.
You too.
All right.
Thank you.
You're welcome. Bye.
Bye.